This is just a short video just to show you how one change to your diet can significantly lower markers of inflammation and disease in the whole body. This is a really simple addition that can make a massive change to your health overall. The research we will be discussing, of course I'll get to exact dose shortly, showed in how 10 weeks there were marked reductions in 19 inflammatory blood markers. Modern scientific research implicates inflammation as causal for a range of disease states. Chronic or long-term inflammatory compounds, like interleukin-6, are promoters of cancer, rheumatoid arthritis, cardiovascular remodeling, and heart disease, Alzheimer's, etc. So let's get to the point. There is a large overlap in all the research on diet and the microbiome, or the health of the protective bacteria in your gut. Decreased microbial diversity is seen in Western societies, where chronic disease is most prevalent. Most chronic disease states share inflammation as a common determinant. One way to change your microbiota or decrease inflammatory markers is to add fermented food to your diet. Fermented food contains live bacteria and has a long history of safe consumption in lots of cultures. You may have tried them already. Foods like kombucha, a type of fermented tea, kefir, which is a type of fermented milk, and kimchi or sauerkraut, which is fermented cabbage. Sound horrible, but actually tastes quite nice. It has to be live though. Most supermarkets sell these foods, but they are pasteurized or heat treated to kill the bacteria, so you want to avoid these. The TV program Trust Me, I'm a Doctor investigated a wide variety of homemade and shop-bought live food. Non-pasteurized food had lots of diverse bacteria at any significant level to pass through the gut. The millions of bacteria in live food, like lactobacillus, add diversity to your gut bacteria. This program also tested just probiotics like supermarket yogurts, and you probably guessed it. There were no significant changes to stool samples, showing that most of the bacteria didn't really make the journey through the stomach. But the fermented foods made a significant change to gut bacteria. Now to the dose. There were 36 healthy participants. No major changes to the diet except to add increasing amounts of fermented food, and they could choose any fermented food or combination of they wanted. By week 10, participants were consuming 6 servings per day, which isn't a great amount if you think that just one small cup of yogurt for breakfast, a small bottle of kombucha for lunch, and a cup of sauerkraut at dinner was considered equivalent to those 6 servings. Just a side note, these products aren't cheap, but you can make them easily and cheaply at home if you just follow some online recipes, easy to do. And that's it. Just by adding live fermented food for a few weeks, you can modify your gut health and diversity and drop harmful systemic inflammatory markers that are associated with a range of diseases. Obviously, I would be remiss if I didn't say that just doing this is important, but also it's caring about your diet and exercise in general. Avoiding inflammatory foods like saturated fats and sugar are important for health and longevity. Add olive oil instead of saturated fats. Avoid white rice and white bread that have high sugar and spike insulin. Have a variety of fruits, vegetables, and a colourful plate, whole grains and lots of fibre. Get plenty of exercise. Keep a healthy weight. And of course, one that people forget is get plenty of sleep. Well, I hope that's mostly obvious anyway. Thank you for watching the video. If you like today's topic, please like and subscribe as it really helps the channel. Thank you.